Ladies and gentlemen, this video is made to help you with medical vocabulary. So we will simplify as much as possible all the basic words all doctors should know. Well, I will give you some words and some context as examples for you guys to see how these words could be used in context, okay? So let's get started with the first part. We will dive into the anatomy of the body. And the first part will be the cardiovascular system. So pronounce with me, cardiovascular system. An example, the patient's cardiovascular system is healthy. Well, let's get to the next one, respiratory system, which is responsible for breathing. The example is her respiratory system is compromised. Okay, with the next part here is digestive system. So we have this system that's responsible for digestion, and we have some organs here, which is stomach, intestines, and liver. We have other organs as well, but these are the three examples here. Next one, the next example to display this in a context is her digestive system is really healthy because of her diet. She eats really healthy. Well, let's get to the next part, which is the nervous system. Yeah, this O-U-S here is pronounced as is, nervous system. Okay, nervous system, example sentence. After the accident, we're monitoring for any signs of nervous system damage. Okay, here we go to the next one. Musculoskeletal system. Musculoskeletal system. All right, example sentence. He is experiencing joint pain, which may be related to the musculoskeletal system. Okay. The next system is the immune system. Speak after me. Immune system. All right, the example sentence here is after chemotherapy, her immune system became weaker and more vulnerable to infections. Okay, let's dive into basic symptoms that everybody has every now and then. It's common symptoms that we have in common. So let's dive into the first one, which is the fever. A fever. I have a fever. She has a fever. So one of the examples here is he has a high fever and needs to rest. Next symptom, basic symptom, nausea. This SEA is pronounced as jia, nausea. Okay. The medication caused severe nausea. Well, next one, a headache. Okay. I have a terrible headache. She has a terrible headache. Okay. Next symptom, dizziness. Dizziness. She felt dizziness after standing up too quickly. Okay. She's been feeling extreme fatigue lately. Well, the next one is a cough. This GH is pronounced as F with a F sound. So a cough. Right? So the patient has a persistent cough. An earache is the next one. So we can have an earache. Common example here is the disease that everybody must have had. I have had this disease in the past, and it's otitis. Otitis is a common cause of earache in children. A sore throat. A sore throat. She came in complaining of a sore throat and fever. Sore throats. Well, let's go to the medical professionals now. Basic terms of medical professionals. Of course, we can have thousands of different medical professionals, and we will cover just a couple of them here so that the video doesn't get so long. Okay, so let's get to the first one. One of the most common medical professionals, general practitioner, GP. Basically, it's the doctor who provides primary care. The nurse gave me my flu shot. Nurse. Okay. Next professional here is a surgeon. The surgeon performed the operation successfully. Next professional, pharmacist. Ask the pharmacist how to take this medication. Next professional, dermatologist. Dermatologist. I saw a dermatologist for my skin rash. Next, psychiatrist. Guys, this pronunciation here is important because here you don't pronounce the letter P. It's silent. So you say psychiatrist. The psychiatrist adjusted his medication. Well, we have also the oncologist. She is seeing an oncologist for cancer treatment. Well, let's dive into now medical treatments. First one is prescription. So the doctor can give people prescriptions. The example is the doctor gave me a prescription for antibiotics. Okay, next one is vaccination, syringe, and ampule. The nurse used the syringe to give the vaccine from the ampule. So we have also surgeries, or surgery in singular. He underwent robotic surgery on his knee. Okay. Anesthesia. The patient was under general anesthesia during the procedure. Physical therapy. After the injury, he needed physical therapy and used a walker to move around. So this object that the old man is using is called walker. Right, next one, chemotherapy. Chemotherapy. Hair loss is a common side effect of chemotherapy. Well, let's go to the next one, biopsy. The doctor ordered a biopsy to analyze the lump. Okay. Now let's dive into organs. So organ number one is the liver. It's responsible for filtering blood, producing bile for digestion, metabolizing nutrients, storing energy, and producing proteins. Kidneys. We have two kidneys and they're responsible for filtering waste and excess fluid from the blood, maintaining electrolyte balance, regulating blood pressure, and producing hormones. Okay, we also have lungs, very important organs here because they're responsible for the gas exchange. So they facilitate the intake of oxygen from the air and the release of carbon dioxide from the blood. Well, we also have the pancreas, responsible for helping the digestion and regulating blood sugar. Very important organ. And this is the end. Well, I made this video just to simplify some basic medical terms for you guys to get used to it. And we have to try to use this as much as possible in class while we practice English and we build confidence and fluency. See you guys in class.